Okay, Mark, so we're talking about the kinetic control course that was managing movement and its solutions for the SIJ in pelvis. So this is a level 3 course. You taught one recently. What was a bit of the feedback that came from the course?
The feedback was that it was a really integrated and comprehensive course in terms of, the first time people really understood that their sacroiliac joint does move and it is a source of pain, and understanding what sort of pain mechanisms come from it. Then also really getting an understanding of grips of the biomechanics of how the pelvic joints move in functional activities. How there's 4 joints: the left and right sacroiliac joints, the L5S1 articulation, and the pubic symphysis articulation between both innominates. So really getting a good understanding of how any movement in one of those creates movement in all the others, and how everything has to adapt. We then one of the things that the feedback was is that for the first time people start to understand that there's no one test that's going to be reliable, and actually there's not a lot of validity in a lot of the tests, but we can have based on a good clinical reasoning of the understanding of the biomechanics and physiology of movement, we can then develop a series or a battery of tests. And the battery of tests helps people systematically work through the problems and work out whether the problem is a sacral problem, whether it's an innominate problem, whether there's a pubic component involved as well, whether the lumbar spine is secondary or primary, or the pelvic joints are primary. So then based on those decisions from testing, we can then start look at some retraining options. Retraining was systematic in that we have a way of identifying, once we've identified restrictions, we then use palpation to identify the position of adaptation or compensation for those things. That gives a diagnosis. Then from that diagnosis, we mobilise restrictions using modified osteopathic type techniques, but they're very effective at changing and recovering movement. So we do retest for movement outcomes and show that we can mobilise and restore normal movement. And then from that, we then have to go on and look at some secondary components of controlling the compensations that are uncontrolled.
And if there's one key thing that people are going to take away from doing the course that's going to really be applicable to their clinical practice, what would it be?
Okay, understanding the joint system, understanding how it moves, what it's meant to do, what goes wrong with it, and when something goes wrong with it, come up with a clear pathway, a clinical reasoning pathway of what we're going to work on, what we have to mobilise. Do we mobilise the sacrum? Do we mobilise the innominate? What are the techniques to use? Give lots of tools for lots of options of those techniques. And then once we've got that diagnosis of the compensation, strategies to then regain control of the movement that's uncontrolled or pain producing. And so the idea then is that we can either look at controlling flexion-based symptoms or extension-based symptoms. All SIJs have a unilateral nature to them. So one of the things that was a clear message that from the course and was appreciated in the course is that, the primary thing to start fixing first is retraining control of lumbar-pelvic control of rotation and side bending. Once people have got that back, once people have that as a starting point, then everything else can start to fall into place in terms of are there additional flexion or extension-based symptoms. Then the final bit was looking at, some SIJs have instabilities or functional instabilities as part of it, not all of them, but when that's present, how to identify that. And then that was something that was a clear message in the course, and got good feedback from, is that people understood then how we can identify, is there an uncontrolled instability or functional instability, how to test for them. There's no one test that identifies instability. We had a battery of 5 different tests looking for movement control, self-locking issues. People were then taught to palpate for hypermobility within the short and long arm glides of the sacroiliac joints. And then people we actually got lots of practice at working. It's lots of hands-on experience at evaluating and feeling for the corrections.
And just with regards to the SI joint in particular, it seems to be a really misunderstood region of the body. Yeah. People talk about it in many different ways. And why do you think that is?
I think part of the problem is that because the movement's so small, you can't see it, and you can't see the movement. You can't see whether it's hypermobile or restricted. There's been an assumption for many years that the sacroiliac joint doesn't move, therefore it doesn't hurt. But that's clearly crazy. It's an innervated joint. It's got innervated tissues around it. There's muscles, ligaments, capsules, all that are innervated. It does move and it does hurt. And what people got is a real feel for how to palpate the movements up there. They're reliable to palpate. There's good reliability to identify is the movement normal, is it restricted, is it hypermobile. and then also not all hypermobile movements uncontrolled. So the other advantage was don't make assumptions. We've got clinical tests, we've got clinical strategies. We can make a diagnosis of the movement control impairment, and we can look at retraining strategies to recover control of those movement control uncontrolled movements.
And following on from this SIJ and pelvis course, what would you recommend as the next course to do?
Okay, the next course to do, that could be, well, again, depends on what people started with, but most people who would be doing this course have come from some background of having done some other courses previously. It makes it easier. But this course was very comprehensive in covering the sort of the muscle synergies that go with the local and global, the local muscle control, the global stabilizer, mobilizer impairments and synergy changes that are linked into central upregulation and downregulation of muscles. The next thing to go into would be looking at something along the lines of thoracic and spine and ribs. People looking at the lower quadrant. All of the level 3 courses are progressions, and or not so much progressions, but other starting places to work within the whole movement control system. Using trigger points to deal with pain, and using trigger points to help change impairments in the local, and in terms of the global stabilizer, global mobilizer muscles is also a really useful follow-on.